We nominated Claire because we have seen in her the spirit of compassion lived out in 3 of the programs that she's been a part of.
She started with the baby care program. She also was instrumental in developing the nursing archives, and also she was extremely important in developing our program called Healing Connections.
Healing Connections supports women who have been diagnosed with breast cancer.
Having somebody that had been through cancer was very nice.
She has been known as that person who has given that loving hug, and a hug that they will never forget.
I would say Dr. Krulak has been an absolute wonderful example of respect. He, in his every dealing with people, is always respectful.
He's an excellent physician for pediatric patients, kind of get their mind off the situation that they're in.
I think we're all sort of working towards a common goal that, treating individuals as we would like to be treated ourselves in the department, I think.
He's one of the most approachable doctors we have.
His advocacy for vulnerable, and particularly with mental health patients.
Very patient with taking questions and any concerns the families might have, and he's an approachable guy.
In terms of collaboration, Oliver is collaboration. We tasked him with taking over both MDR departments, one here and one at the Grey Nuns Hospital. He did that, it seemed like seamlessly. I'm sure it didn't feel like that from his point of view, but from ours it did.
He's very kind and cares a lot about his staff, and wants them, to work well together.
I'm blessed to have a very good team. I work with excellent immediate reports at both sides.
I love having him on a team because essentially I know that he's going to find unique and creative solutions to problems that we have. He's got that sort of mastermind approach about him. He's always doing something for a reason.
He is leading the way by being an excellent role model and showing us that it can be done, and it has been done, and it's working.
Early in October, here at the Edmonton General, we opened the Enhanced Support Unit. It was brought to our attention that we had residents waiting in acute care or perhaps in long-term care inappropriately placed. Padumo's contribution stood out for me. She was involved in developing the model of care, the early communications about the program. So once we recruited the staff, she was also involved in educating the staff, developed the education program.
I speak for those who might not be able to speak for themselves or who don't have the opportunity to do so.
She was just tireless in her efforts and really represented what social justice is all about, being a voice for those most vulnerable and ensuring that every resident, no matter where you come from, that you have opportunity to the same good treatment and care that everyone else has.
The team here is extremely tight, and Catherine is the main reason of that.
She's our moral compass. If we're in a situation, how would Catherine deal with that?
So integrity is about honesty, it's about ethical decision making. Put yourself in someone else's shoes.
She manages the group, extreme open door policy. She truly cares about each and every individual, and she makes people within the department feel that. And in everything that she does, the root of it is people.
She globally thinks about issues. She collectively thinks about the entire direction of the organization.
It's easy for me to get up in the morning and come to work because of the people that we work with.
Marcy Humphrey was nominated for the Mission Award of Stewardship due to her expertise, her knowledge, her ability to go above and beyond, and looking forward to advances in innovations.
I just find that helping patients and being able to do my exams with them and make it easier for them is a real gift.
Well, there isn't a day that Marcy comes to work without a positive attitude. Most recently, she came forward with an idea of something she had seen at a conference, and it was a new innovative type of IV set. She single-handedly researched the information, contacted the sales reps, got me on board.
She also looked at a new CT contrast for the diabetic patients. She researched it, she talked to the companies, she brought it in, she brought it forward to her manager, and she just showed so much enthusiasm and creativity that I felt that she needed to be nominated.